Hello. So my name is Janice Kitsualo. I am an occupational therapist, and I've been an OT for many years, as Dr. Day alluded to, over 30 years, and 20 of those or more have been spent here at the Children's Hospital. My focus primarily had been on helping young children with developmental problems. Since Dr. Day has been with us for 3 years, I've had the privilege of working with him in his multidisciplinary MDA clinic and happily using some dormant OT skill sets that I hadn't put into place for a long time. And that's primarily because of the diverse mix of children and their ages from 0 to 22, which means that some of them are adults and they're pretty scary after a while, but not scary anymore. And I feel that I've learned the most from those who have transitioned into the adult world, as I call it, which is very different from the pediatric world, as I've learned from my table of colleagues over there during lunchtime. So what they've taught me is the importance of equipping them to the best of my ability so that they're able to participate in a meaningful way in their life. So my talk is entitled, "A Little Help Goes a Long Way, Aids for Living Independently." And so this is really about equipment and occupational therapy. My objectives are to describe how the common problems of CMT can affect activities of daily living. And in the therapy world, we talk about activities of daily living with an acronym ADL. Have you heard that term? Anybody? To discuss occupational therapy, or OT, for CMT. To describe the OT evaluation and the aids for daily living. What are they and how they can help? So I'm just curious, what does it look like? Show of hands, anyone who's had interactions with an OT in their own medical care, health care? Okay, all right. I know physical therapists are a bit more involved because of the lower extremity problems that can occur, but as Dr. Day suggested, even though the physical problems may manifest in the legs, you're all connected. So if you're having difficulty with balance or strength, it may have an impact on the rest of what you do, who you are, what you would like to do. So an OT may be helpful. Just to review some of the common problems of CMT, we have lots of information now about that there is muscle weakness and that it occurs distally in the feet, then in the hands that follow. Balance issues can occur during transfers or movement. Standing still and walking can become a problem. There are changes that may occur in the use of the legs and the feet and gait especially. Changes can occur in the hands and fingers, affecting your fine motor skills, holding, grasping objects. And Jonah gave us a good description of how it can really impact how we use our hands. Changes can occur in the sensitivity to temperature, hot or cold, especially in the hands and feet. We know that stress and pain and fatigue can worsen the symptoms, and that the onset of the symptoms may be gradual, but can result in significant changes in function and the ability to carry out important ADL. So OTs and PTs are all about function, and I work very closely with a physical therapist, so I know that. So how one functions is important regardless of your age. So in earlier stages of CMT, problems such as tripping and loss of balance may indicate the onset of lower leg problems. And for that individual, more concentration is needed to carry on, so that looking at a flight of stairs may cause one to think about it twice before starting. And I've had encounters with that in some of my patients. Hands can also become weak in the fingers and thumbs, which limit pinch. Buttoning, as I've heard, picking up coins, holding a pencil to write, opening a door of a car can be challenging. With the growing weakness and fatigue, tasks such as taking care of yourself, taking care of your household and work can become more difficult. If you were to encounter an OT somewhere, they may suggest assistive devices that can make it easier for you to function as your needs change. So actually consulting with an OT, not that I'm pushing it or anything, but it may help improve your function. OTs provide therapeutic activities such as range of motion exercises and patient and caregiver training and education. There is a picture, I hope you can see it, of a therapist helping an individual into a shower since he's having some difficulty doing that. OTs teach compensatory strategies, so there's more than one way to do something, and we try to teach using stronger muscle groups rather than trying to wear out those weaker ones, to use energy conservation techniques, and to support weak muscles through various means. OTs also recommend modifications to the home, to the job that you do, as well as to the workplace. And I kind of picked those areas just because we spend a lot of our time in middle and later adulthood in these areas. OTs also make or recommend adaptive equipment that make it easier to carry out daily living tasks. And the picture at the far end on the bottom shows a therapist assisting a man with trying to put his socks on. And there's a device that he's using. It didn't show up too well in the picture, but I have a picture of that. Who is the OT? The OT is one of the members of your healthcare team, I hope. Here in our clinics, we have a number of people who address the barriers to motor function and independence. And besides myself, I work with a physical therapist, speech-language pathologist, who is also an assistive technology person, very, very specialized, and we have orthopedic surgeons who are also very helpful. I suggest consulting with an OT who's familiar with CMT annually. It doesn't sound like there are many that you have seen out there, but I guess I'm spoiled. I would say to report any changes in function or your occupational performance. We do want to keep people engaged and participating as much as possible in the things that are important to them. So what does an OT do? The OT helps people across the lifespan accomplish meaningful activities of daily living, and those activities may seem kind of trivial or unimportant, but there are things such as eating or feeding yourself, bathing, dressing, playing, writing, working, driving, and it's when you start losing the ability to do these things that it really surprises, I think, many of our folks. What the OT cares about are those occupations that are important to the individual with CMT at their stage of life. So I work with children who basically play, or they're students, they become homemakers eventually, or learn the skills of homemaking. They are workers or wannabe workers, and ultimately, as a retiree, you have many, many things that are important for you to keep doing, and we'd like that to keep going on. OTs work in hospitals, rehabilitation centers, outpatient clinics like I do, in schools, and I think we have an OT, a school-based OT here, or we did this morning anyway, and also in private practices. OTs may specialize in areas. I specialize in pediatrics. There are those therapists who specialize in driving or adapted driving for those who are having some difficulty in that area or losing skill there. Seating, assistive technology, home health. They can visit you at home if you need help. Hand therapy, and rehabilitation, general rehabilitation. Our evaluation sort of looks like this in a nutshell. We do consider the age and the stage of development of the person, the individual with CMT. We want to know what their pain is like, their upper extremity function, range of motion, fine motor skills, and we also want to know what's important for them to do. What is their occupational choice? How do they perform it? How do they take care of themselves? And what their activities of daily living look like. As a developmentalist, it is important for me to know what stage of development the individual is in that I'm working with. And that's basically because there are certain things that we can expect in development depending on the age of the patient that we're working with, and things that we can count on. For example, the young child struggles to master motor and cognitive skills. The young adult strives for autonomy and independence. And the middle adult values family and job stability. The older adult values hopefully retirement and maybe having some private time, alone time, as well as to be able to share the wisdom with others in their family and friends. So, I think pain has been talked about already, and I'm just going to touch upon it. It is part of our evaluation because pain can color how someone is able to function. There is, of course, the musculoskeletal pain that's been described as the overstretched muscles, the muscles that get a lot of wear and tear, the ankle, the foot, the toes, and in the upper extremities, the wrist, hand, base of thumb, and low back. There are also those sensory neuropathies, the tingling sensation or burning pain. As an OT, I want to know if the individual is able to identify what those pain triggers are and how savvy they are about protecting themselves. So, those pain triggers could look like cold sensation, stress and worry, or just plain ignoring body signals and not pacing oneself. In terms of upper extremity function, the OT will assess how the arms and hands move and how they are used. Changes in the hand function may occur suddenly or gradually, and I think in many cases they can follow changes that have already occurred in the lower extremities. So that's sort of a double whammy. It's unfortunate, but I think that we would love to support continued hand function as long as possible in a good way. Changes may affect range of motion, just how you use your hands, and as well as strength. So I have some pictures shown on, sort of what can occur with, with weakness affecting joints and in the fingers. Up top in the diagram, I have just pictures of more typical hand movements and the shapes of the hands. So we can sort of see that, that can be a problem as the hands become affected. OTs assess activities of daily living, as I described, and I split it into two areas. One is self-care, and those are the things that how I take care of myself. Dressing, grooming, hygiene, toileting, bathing, moving in the bed, transferring from one spot to another, feeding, and just plain resting, how you recover with sleep at night or taking naps. The other area that we care about are those things called occupations, or how you spend your time. We have different roles, each of us, and we have multiple hats that we wear. We could be a cook. We could be someone who is very active, moving around in the community. We could be a driver, a homemaker, a shopkeeper. We could be a caregiver to a parent, a caregiver to a child. Sometimes, we're caught in the middle. A student, or a laborer. So these are just this, sort of a limited list of many hats that we wear that OTs care about, because we want you to continue to fulfill those occupations. In this next section, I have pictures or examples of adaptive equipment and modifications that might be helpful when you have CMT. So the talk that I'm giving is about aids for independent living, things to help prolong and to improve the ability to be as independent as possible. So I'm going to talk about what adaptive equipment is. And adaptive equipment is actually a device or a piece of something that compensates for weakness, loss of range of motion and strength, reduced safety perhaps, or a decline in quality of life. And the three categories that I'll describe, one would be a brace, which have other names. They're called orthoses or splints. And the top picture shows a kind of a splint that is used to rest the hand, the wrist, maybe while someone is having some downtime or sleeping at night, so that you're not squeezing your hands or putting them in abnormal postures. Adaptive devices, such as in the middle picture is a reacher. I don't know if the reacher extends your reach if you're not able to balance maybe and get that object that's up on a shelf. A reacher can be handy. And the lower picture is a piece of mobility equipment. It's a durable medical equipment, a power scooter that can get us from place to place and still be able to stand up and walk a short distance. OTs like to make splints. We're kind of like the MacGyvers of the rehab world. If there's a problem, we say, I think I can make something that makes it a little bit better. So that OTs make and fit proper splints to keep the wrist and hand in a functional position. The picture with above me, I guess to my right, shows a pair of hands that have weakness and are sort of dropped, going into gravity. It looks like there's some effect to the fingers, the wrist, as well as the thumbs, and maybe a source of pain in that position. So we try to think about preserving the normal architecture of the hand, and that's what the top picture with the splint tries to show, keeping the palm open, the wrist supported, and it can actually alleviate some discomfort upon taking it off, so that you can use your hands, feeling better the next day. Splints provide stability in joints that are affected, and again, reduces injury, reduces deformity, assists with pain management, and hopes to preserve muscle efficiency. We try to keep the muscle length just right, so that you can use those muscles well. The other two pictures below the top one show different kinds of splints that can be worn during activity. The one on the far left allows the fingers to be used and the thumb, and merely supports the wrist in that one position, so it is a fixed position. The bottom picture shows support that would stabilize the thumb, so that you could actually use your wrist as well as use your fingers to pinch, perhaps. It puts the thumb in a place that you can actually use it. The following pictures will show examples of adaptive equipment that may be helpful to those of you out there. Can I use the cursor? I don't know how to use the cursor. I'll just point. At the top picture shows an adjustable toilet rail, which can be helpful if you're standing at the toilet or you're trying to get up or down with control. They affix to the commode and basically give you just a point of stability. Next to it is a portable bidet that is a hands-free toilet use, attaches to the commode, might be helpful to some. The lower picture, the bath mitt with soap pocket, is helpful for those who have difficulty grasping a washcloth perhaps, and doesn't require any grasp. There's a little pocket for soap that you can scrub yourself with, and that's easy. The last picture here is a toilet to tub sliding transfer bench. So you can actually, if your interior of your bathroom looks somewhat like that, but there are different conformations of it, you could sit on the toilet and slide over and without having to step over the side of the tub. This page shows grooming aids. The blow dryer holder that affixes to the wall requires hands-free. The aerosol can spray grip, if those of you who use hairspray or any other kinds of body spray, instead of pushing that little tiny button, can use a larger movement, using larger, stronger muscles perhaps, to activate it. This picture of the cuff with the electric razor doesn't require grip, but you could use a electric toothbrush or razor in that. The loop scissors in the far end is something that requires hand movements versus finger movements. Dressing, who needs to do buttons? I heard buttons many times today. Okay, there's a thing called a button hook that can be very helpful, and that's the upper picture there. They're really great on small buttons for dress shirts, maybe even those polo shirts. They come in many different sizes and weights, but can be very helpful for those who need it. In the upper corner is a 2-in-1 dressing stick. The dressing stick has a foam buildup for the grip, to build up so you're using larger muscles again. And it's good for reaching around if you're having a difficult time getting that shirt up over your shoulder. In addition, it has a shoehorn. A long shoehorn can be so helpful for so many people. I use one all the time. You can do it in sitting or standing. This lower picture shows clear zipper pulls, meaning you don't have to pinch that zipper pull anymore. You can just put your finger in it, pull up or pull down. And then you can't see it. It affixes to your zipper that's already in place. That's a picture of the sock aid that the man was pulling up, trying to put the sock on his foot. The sock goes on the blue section. At the top, it's folded. You slide the sock on, and you put your foot through it, and you pull up. And that way you don't have to do a lot of bending from your hip either. There's so many gadgets out there that OTs love to share, and we love to always look at these things. But I'm just going to pick a few. In the center at the top, in the middle, is a wrist support and utensil holder. So for those of you who may have a wrist drop or have some weakness in your wrist and having difficulty holding on to that utensil, it's sort of like a splint that you wear. It holds your wrist up, and there's a little pocket that you can thread, you can put a utensil in, a spoon or a fork, and it just allows you to then feed yourself that way. Below that is a universal cuff, and what that is something similar, but it's just a Velcro cuff with a pocket that you could thread a fork or spoon or even a pencil or a pointer or a stylus if you needed to. So it's got multi-uses. Over on the left are different kinds of knives that are ergonomically, can be very helpful to you. The top one shows a rocker knife with chunky handle that requires movements maybe from the shoulder or the elbow versus your wrist in order to cut something. So these knives are fairly sharp, and it just requires a little bit. The Eskimos knew what to do because the design is from the Eskimo people who use ulus, or people who skin animals. They have the right idea. Let's see, the lower picture shows a kind of a chef's knife, again with a large handle that requires more of a shoulder motion, sort of a sawing action to cut. I'm just gonna move on. In the home, these things can be helpful to you. Door handles in the middle that require a push versus a turn are much less taxing. In this kind of door handle extension, you can also put a loop on it so that you can just pull it down with your forearm, so you don't have to do any pushing with your hands at all. Who has an easy off jar opener? Who has special jar openers? Nobody? Okay. There are all kinds of jar openers. There are ones that you put on and you kind of push this way. Or with this one in particular, if you had, it's affixed under a cabinet with two hands in place, you can, just save your joints a bit and use two hands for a stronger action than just one. I put the two-handled pot there because two-handled pots are the way to go. We don't want single handles. Two-handled pots distribute the weight of the contents a little bit more evenly, and you could actually have more control as you slide your pot across your counter instead of picking it up. I also showed this pair of scissors that can sit on top of a table that requires pushing maybe with your whole hand or your base of your hand, and you can guide paper with the other. Let's see. Leisure-wise, you might like this. There's a lift chair that is very comfortable. If you've never tried one, you should go to a medical store and try. I tried all of them. Many are electronic and help you going from a sitting to standing position and vice versa. They're great. Some even have leg rests that come up. It's great. I also showed a book stand, and that way you don't have to hold on to the book. You can just turn the pages. Below that, the e-reader is always the best because you can increase magnification of the letters as well as just easy turning. From the CMTA newsletter, I picked up this idea of the cozy foot and hand warmer. There are some special ingredients in it that you stick into the microwave, and you have a warm foot and warm hand for several minutes. So I think it's a great idea for those with temperature regulation problems. Just to wrap up, I just want all to remember to pace your activity, use stronger muscle groups to compensate for weaker ones, and to support your weaker muscles. Now you have many strategies to do that. I would like to recommend, at least annually, to consult with an OT familiar with CMT, because we want to catch those changes in function and occupational performance as soon as we can, because we really want to keep you engaged and participate in all those important things that you want to do. The OT can assess whether special equipment or other strategies may be helpful to improve your participation, and it's all about participation. So I want to thank Miss Elizabeth and CMT and my great MDA team. Thank you.
Thank you so much.